Uh, Welcome everyone to the first of this podcast series of COVID Kenya by OBIS. My name is Paras Shah. I'm a lawyer by profession practicing in Kenya, and our team in COVID Kenya intends to supply relevant information and verified information on COVID to the general public in our communities for their benefit during this very challenging period for all of us. The first in our series of podcasts, we have Manoj Shah, who is the chairman of the Social Service League, which operates one of our hospitals, MP Shah Hospital. Manoj Bhai, welcome, and thank you very much for agreeing to speak to COVID Kenya by OBIS today. I know you're very busy, so we will get straight to the point. Today, we would like to get your very valuable and experienced thoughts on two issues. One, the state of our health facilities in Nairobi, and in particular, MP Shah Hospital, in dealing with the COVID-19 pandemic. And secondly, we are aware that you yourself have been a victim of COVID-19, and we would like to, if possible, for you to share with us your experience as a patient of COVID-19. So we'll go straight into the first part. In respect of the state of our health facilities, please let us know what the current status of the facilities is and what the preparation of MP Shah Hospital is for the next, I would say, 4 to 8 weeks, which are critical for our country.
Thank you very much, Paras, for inviting me to share some of my thoughts and my views with the rest of the people out there. And I want to, on the onset, congratulate you and the entire team for forming COVID Kenya and for taking up the challenge of educating our public and for giving them inspiration and motivation as we deal with this pandemic. Talking about our facility, the MP Shah Hospital, I just want to share with you, it's almost 3.5 months down the line that we are dealing with this pandemic. And at the hospital today, we have a very well prepared and dedicated and a fully trained COVID team that is in place. At the same time, our hospital is prepared with 3 dedicated wards just for COVID patients to isolate, to treat them, and to make sure they turn negative with a capacity of 70 beds. At the same time, in our critical unit, we have 12 beds fully equipped with monitors and ventilators. We do have an expansion plan where we can expand our capacity by another 22, making a total of 104 patients that we can treat at our facility. We do have challenges in increasing the capacity, which I will talk in a few moments, in a little while. But in addition to the COVID preparedness, our hospital also has a 24-hour dedicated helpline to help anyone who has COVID or who has indications of COVID or who has any problems pertaining to COVID. They can get help from the MP Shah Hospital on a 24-hour helpline basis. At the same time, our hospital has introduced online consultations. So all our COVID patients, all our other patients don't need to physically come to the hospital. As long as they inform us online, our doctors can arrange online consultation for all of them. On an average, every day, we are doing anywhere between 50 to 70 online consultations from our main hospital and our satellite facility at the village market. We also have a very dedicated pharmacy on wheels, whereby people don't need to come to the hospital to get their refills or to get their drugs. We make sure that we send the prescriptions right to their doorsteps. Lastly, our hospital is also fully equipped with ambulance services for any emergency or anybody who needs treatment at any time of the day or night. So in terms of preparedness, that's how well our hospital is prepared. In terms of COVID, for the last 4 weeks, our hospital has been working on full capacity. In fact, for the last almost 20 days, we have had no availability in our critical beds. All our ICU units, our ventilators, monitors are completely fully utilized without any additional capacity. So we are operating almost on a full capacity at this point in time. And just to conclude, I just want to share with you very briefly some of the challenges that the hospital is currently facing in dealing with the COVID crisis. One is the PPEs, where the availability, the cost of the PPEs, the supplies of the PPEs is really becoming a challenge as we battle the pandemic. In addition to that, the biggest challenge that we have at our hospital at this point in time is the limited number of critical care facilities and the ventilators. As we go deeper into the pandemic, as we get more people admitted into health facilities, this particular component, life-saving component, is really a big challenge in our hospital and, of course, in many other hospitals. At the same time, increasingly, staff is also becoming a challenge because there's a lot of fear and they do need a lot of motivation to work with COVID patients and in the COVID ward. And lastly, one of the other challenges that our hospital is facing is how to keep our COVID patients mentally well, and mental wellness is one of the major and critical issues that our hospital is facing at this point in time. So that's in a nutshell what's happening at the MP Shah Hospital.
Thank you, Manoj Bhai. I think it's very clear that the situation is critical in our health facilities, but it's also good to know that MP Shah is certainly prepared and has been preparing for a while. Saying that, for our listeners, it is very clear that the health facilities are overwhelmed, and I suspect will continue to be overwhelmed for the next coming months. Just one question, picking up on that summary that you gave us. The life-saving equipment, in particular ventilators, are you aware, or do you know if there is plans nationally or locally in Nairobi by the government and by others to seriously ramp up? I saw an article today that Mobius Motors are making ventilators here in Kenya, but are you aware of any real plans for ramping up availability of ventilators?
Yes, there are a lot of talks and discussions that are going on with many of the government facilities. The government, through the funding that they have received, they are striving to add new ventilators. But again, the challenge with ventilators is twofold. Number one, life-saving, good quality ventilators there's a big shortage worldwide, and they are not easy to get. Secondly, yes, we can get some of the homemade ventilators or some of the other ventilators. Whether they will work in a critical situation or not is another big question mark. Or whether they are safe to use as per the WHO guidelines is another question mark.
Yeah.
As far as the MP Shah Hospital is concerned, our biggest challenge is to finance or to get enough sustainability to bring in more ventilators and to increase our critical care units.
Yeah.
So that's one of our biggest challenges in order to increase our critical care capacity.
And if there are any well-wishers out there who would like to support MP Shah in terms of funding of ventilators, I am assuming that they can just get in touch directly.
Yes.
With the Social Service League.
In fact, we are going out to the public. We are requesting the public to support us in two critical areas, because our hospital is a non-profit making institution. There's a lot of social work that we are doing, especially for COVID patients. And at this point in time, we are looking for well-wishers who can donate us the much required PPE and other equipment to treat COVID patients. So this is a request that we have made out to the public. And if there's anybody who wants to assist us in that manner, we would really appreciate that, because the cost of servicing a COVID ward, just one ward, is anywhere between 300 to 500,000 shillings a day. On an average, we use about 60 PPEs just in the COVID wards. And I can go on and on and on, sharing with you how expensive it is to treat COVID. At the same time, one of the biggest appeals we are making out to the public is that if there's anybody who can help the MP Shah Hospital with ventilators, we would really appreciate your support. You would be saving tens of lives, hundreds of lives by just donating or making ventilators available to hospitals like ours. This is a very passionate appeal to everybody out there.
Thank you, Manoj. What we will do is on the COVID Kenya website, we will provide a link to our friends out there. If they want to get in touch to make donations, they can use that link and contact the Social Service League.
Thank you.
Just turning to kind of patient experience, if I may. From your experience in the last 3 months, or the hospital's experience in the last 3 months, what advice would you give to people who think they might have symptoms of COVID-19? What should they start doing at home first before they visit hospitals, and when? The critical question is, when should they visit hospitals?
So my advice to anybody who feels that they have symptoms which are related to COVID and that have been widely distributed in the media is first and foremost to isolate themselves from everybody else. It's the first sensible step to take, because you will be not only protecting yourself, but you will be protecting many other people that you could have come in contact with and transmitted the disease. Secondly, take it upon yourselves, if you have any symptoms, to talk to your doctor on the phone, get some online help, or talk to any of the helplines. Our hospital has a helpline. The Ministry of Health has a helpline. All the major hospitals have helplines. Talk to somebody on the phone and they will advise you on what the next steps are. And don't be afraid. Be bold, go out there and get tested. That is my advice to anybody who has even the slightest symptoms that depict COVID-19.
Once someone has tested positive, if they are relatively asymptomatic or have very few symptoms, they should, I'm assuming, probably stay at home, isolated, and avoid going to hospital until they can't manage on their own. Correct?
Absolutely right. So what I would really like to advise is that once a person has been tested positive, and if he's asymptomatic, it's not as easy as to go home and just take it easy. I think that's the worst thing ever to do. What they should do is, first and foremost, talk to the doctor, get the doctor's guidelines. Second of all, read the home isolation guidelines, which are very simple and specific as to what you should do by self-isolating at home. And number 3, closely monitor yourself with all your symptoms. At least 3 or 4 times a day, take your temperature, take your blood pressure, get a good oxygen meter, test your oxygen levels to make sure that they are above 92, 93 as stipulated, and really look after all your vitals. Because to me, this is very, very critical. And what we have seen in the hospital is a lot of patients come with very mild symptoms. The first day, second day, third day, fourth day, fifth day, they seem perfectly fine. But after the 6th day, they start going down. They really go down. And some of them go down so fast that they need hospitalization, they need additional drugs, they need additional treatment. So my advice to everybody out there, take a doctor's advice, get the home-based Ministry of Health guidelines, do what is specified in those guidelines and follow them very, very strictly.
Great. We will, the guidelines will also be available on the COVID Kenya website, as well as some contacts of that people can call, just for the public out there. Manoj bhai, when a patient does visit MP Shah Hospital with symptoms, maybe I can just ask what he or she should expect when they come to the hospital. Will they be immediately admitted into an isolation ward, or what is the kind of physical process?
So the process is very simple. Nobody needs to have any fear of going to the hospital if they think they are positive or they need to be tested, because hospitals are now fully prepared. We have protocols in place. We have all the measures in place, and not only our hospital, but all the other hospitals. As soon as you come to the hospital facility, you will be put in a special dedicated area that our hospital has created for all the suspected cases. Once you are put in that particular area, your tests are done. The doctor sees you in full PPEs. We do take your test and send it to the laboratory. And until we get the results, we have created a special isolation facility at our hospital where we house you until your results come, and then that will determine what the next step will be.
Right. Great. Just you mentioned earlier about kind of mental well-being in isolation, particularly in a health facility. In the MP Shah case, I know there are, as you said, separate wards where COVID patients are comfortably accommodated, but also isolated. Just from that point of view, there's a lot of fear out there in the public of isolation. Obviously, it is something that has to be done, but perhaps your thoughts from the experience of MP Shah, whether the public should fear isolation or what the experience of isolation in the hospital is like.
So once a patient has symptoms, it's very, very important that you go to a hospital, not only for isolation, but for isolation stroke treatment of COVID till you are tested negative. I know that there's a lot of fear of people going into isolation. We have also realized that being in isolation is not easy, is similar to being put into some kind of a confined place for a period of 2 to 3 weeks for any particular individual without any contact to the outside world. However, at our hospital, we have realized that this kind of a situation can cause mental wellness in a lot of patients. Patients become suicidal, they get into thoughts, they get into different kinds of behavior, mood swings, which could be detrimental to them getting treatment for COVID. At our hospital, we have now found certain solutions through trial and error, and we try our level best to make this a pleasant experience. In fact, all the patients who are in isolation at our hospital have access to everything possible with a 24-hour full-time staff monitoring them and assisting them in all their needs. All the meals are taken care of. We have provided TV, Wi-Fi, cleaning and sanitization. Most important, we have also put in counseling services where a counselor goes and talks to the patient on a day-to-day basis. And in addition to that, we are trying to find new and innovative ways of how we could keep the COVID patients engaged in their own confined places. So it is not all that bad going into the hospital now, because the hospital has made those wards very, very friendly, and you will definitely get a great experience being in those wards.
Excellent. Just turning to non-COVID related emergencies. Emergencies or maternity or terminal illness patients. Are you seeing such patients avoiding coming to hospital? And obviously they shouldn't if they have emergencies, but are you seeing that? And related to that is how are the hospitals dealing with these patients and keeping them safe from a possible infection of COVID-19?
You're absolutely right, Paras. The myth out there is that a lot of people are not coming to hospital for the fear of getting COVID, as they think that coming to the hospital, they will get COVID. But I just want to assure everyone out there that the hospitals are the safest places, because the people working in the hospital have to take care of themselves first before they can take care of anybody else. Talking about the MP Shah Hospital, fortunately for us, we have a brand new tower that we have built, which is distanced away from the main hospital. And this new tower is our dedicated facility. So in our main hospital, we do not do any COVID work. All the COVID work is done in a different place outside the main hospital. Our hospital has a very safe environment. All precautions have been taken. All protocols are being followed as per the Ministry of Health guidelines and the WHO guidelines. And there is certainly no hesitation for any patients who should visit the hospital. In fact, we are seeing a lot of emergency cases at our hospital. And one of the things that is very alarming is we are seeing double the number of cardiac problems coming to our hospital in the last 3 months than we have ever seen before. In addition to that, our maternity wards are full, and there is a lot of maternity work being done in a very safe COVID environment. As far as elective surgery is concerned, it has to be done. It has to be done. And our hospital is fully prepared with all the PPEs, all the precautions in place to carry this out successfully. So the hospital is a safe place to come. Anybody who needs to visit the hospital, if you have a problem, don't hesitate. Your life comes first. Go to the hospital and get yourself checked or treated.
Great. Thanks for that, Manoj Bhai. Just lastly, on the kind of the hospital side, have you got any kind of projections for the next 4 to 6 weeks in terms of the pandemic?
In my personal opinion, this pandemic is not going to go away very soon. The situation is going from bad to worse, and my forecast is there's going to be an explosion of cases, and our hospital is not going to be able to cater for all the number of cases that we are projecting to come in the month of August and September. And even if we make more beds available, but we also have to have a correlation of the critical beds, because by taking in more patients, we also need more critical care services. We need more staff. We need more PPEs. And really, it's not easy to work in this environment.
Yeah.
At the same time, what is very alarming, as we have all seen in the media and the press, the cases are increasing on a day-to-day basis. But what is really worrying, that last month and in the previous month, we were seeing 1 death a day, 2 deaths a day. But in the last 10 days, we are seeing 10 deaths a day, 12 deaths a day, 14 deaths a day. And translating that into what is going to happen in August and September, I can see the number of daily deaths increasing to 20 and 30 every day as we go into August and September. And to me, that is really frightening.
That's very scary statistics. Manoj, turning to yourself, you were tested positive a few weeks ago. Maybe it'll be great for the public to know about your own experience and any kind of tips you have for people who may get tested positive.
Thank you, Paras. And I really want to take a few minutes of everybody's time to share my personal story, so that all of you can be motivated that COVID is not as bad as we all perceive it to be. I was tested positive for COVID 5 weeks ago, and I actually went for testing on a voluntary basis, because I work with the MP Shah Hospital, and all our staff went in for voluntary testing. And that's how I, together with my wife and my daughter, all three of us got tested positively. Till today, we are all very surprised and shocked as to how we tested positive for COVID, despite following all the guidelines and being extremely careful. I guess we will never find that answer of how I got tested positively. However, after having been tested positively, we consulted with the doctors at the MP Shah Hospital. My wife was asymptomatic. My daughter and I, we had mild symptoms that related to the positive test that we went through. The doctors prescribed us to be under home isolation and treatment. We were all given antibiotics for 5 days to take, vitamin C, vitamin D, zinc, and in addition to that, we got ourselves a contactless thermometer, a pulse oximeter, a blood pressure and sugar monitor. My daughter prepared a monitor sheet on Google, as we were told to check our vitals at least 4 times a day and send the reports daily to the doctors who were monitoring us. And for the 20 days that we were in isolation, we monitored ourselves and sent the reports religiously to the doctor. We started on our home isolation and treatment, and luckily, all of us were together following the strict home isolation guidelines. We internally decided to support each other to go through this journey and be strong to handle this deadly fight against the coronavirus. Being settled and having consensus as a family was only a beginning. We still had to tackle the stigma that was clearly being demonstrated by our extended family, friends, colleagues. You can, that whenever you hear that one of your friends or loved ones has been tested positive, you can only imagine the reaction people had to go through. We had to overcome this obstacle of stigma by ensuring that all around us got tested, and fortunately, all that we came into contact with were all tested negative. And we assured everybody and calmed all and communicated in a very effective manner that calmed down the situation. For me personally, the lifestyle that I was living with, such a busy and a social lifestyle, staying at home, facing all the obstacles around us, was something that none of us were prepared for. This was a mental and emotional battle we had to fight ourselves for every moment of the day. And fortunately for the three of us, we had to keep picking up each other and to support one another to get through it. Life at home was not normal for us. We had to strictly follow all the home isolation guidelines, sleeping in different rooms, using different bathrooms, sanitizing all areas 3 times a day. The very little house help that used to come in to support us were all in PPEs and fully geared up. We had to take our medication, and strictly no visitors were allowed to see us. On the other hand, we also started following the Desi Dawa and started taking steam 3 times a day, drinking a concoction of lemon, ginger, black pepper, and honey. And we were also advised to take lots of fresh fruits and vegetable. Luckily for me, my wife made me a turmeric milk almost every day, and all our supplies were ordered online and delivered to our home. Staying at home for active people who have never stayed at home is the most difficult part. all of us had anxiety and stress towards this unknown disease. We had a lot of friends and well-wishers who called us every day and gave us their valued advice as what we should do and what we should take. They did it in good faith, not understanding that they were only confusing us more by taking different types of herbal concoctations, and of course the effects of all these things on the stomach, intestines, creating gas and acidity in the body. The first 4 days were very difficult and stressful for us due to the fear and acceptance of the unknown. We also had insomnia and anxiety as our symptoms were not improving, and my daughter Soyam started having breathing difficulties and urgently had to be put on a Ventolin inhaler. There were also a lot of worries about me due to my age and my underlying conditions of diabetes, hypertension, and thyroid. We only started getting better after the 8th day. During this time, I just want to share with you that our mental wellness was at its lowest and could be seen visibly in anything and everything that we were doing at home. However, upon the advice of a counselor, we decided to walk every day, exercise every day, at least for an hour, and engage ourselves in some activities that would divert our mind. All these measures helped us to keep our minds occupied and helped us deal with our mental wellness. And of course, most importantly, we also prayed every day to the Almighty to ensure that He helps us in getting cured. We self-isolated at home for 20 days and were very fortunate that the doctors at the MP Shah Hospital were monitoring us on a regular basis. However, on the 8th day, my daughter and we felt very sick with elevated temperatures and running out of breath. And on the 8th day, in fact, we got a shock that the doctor suggested that we get admitted to the hospital for further monitoring. However, with a lot of reluctance, we stayed at home and slowly we started improving the next day and the days after that. This was a very difficult disease to handle and understand. With persistence, all our symptoms disappeared after the 10th day and we started feeling much better. We decided to carry out a rapid test after 12 days, which came negative. We did our PCR test on the 14th day, which turned out to be negative for all of us. And as per the Ministry of Health guidelines, we did a confirmatory test on the 20th day, and with God's grace, we were again tested negative. So once we received the results and the green light from the doctor, you can only imagine the joy that we had after 20 tormenting days. We were finally free of this deadly coronavirus that disrupted our lives. For us, this was a very valuable lesson for our family, and on a very positive note, a great outcome for my wife and my daughter. And we all fostered the concept of share, care, and love for each other. And this experience really bonded us together. And after 3 grueling weeks of staying at home, it was a nice feeling just this coming Monday to venture out and to go back to our normal lives with extra caution. This experience will stay as a scar with us for the rest of our lives. So this is my story that I really wanted to share with you and everybody else out there.
Wow. Thank you, Manoj Bhai, for sharing a very personal and painful experience. But at the same time, there's a lot to learn for all of us in the communities where one is tested and one is isolated at home. It is not just a normal isolation. There is a lot that one must do to look after oneself, to stay positive, and to stay strong, most importantly. But thank God that you and your family are well. We are very grateful for that. Manoj Bhai, just to conclude, your final remarks on the current situation, if any.
So my current remarks on the current situation to everybody out there is to stay safe, stay at home if you don't need to do anything else, because COVID can come to you in any form, at any time, at any place. So it is really upon you. You are your own person who you can save yourself from COVID yourself. Secondly, please do not stigmatize anybody who has been tested as COVID. Only stay positively with them and support them to the best of your ability. And lastly, my advice to everybody out there is that besides COVID, if you feel that you are not well, if you feel that you need something, that your health needs to be taken care of, go and get it done. Visit doctors and take care of your health. So those are my parting thoughts to you and everybody out there.
Manoj Bhai, I can't thank you enough for sharing your time with us. I know you're, particularly right now, you're very, very busy. So we really appreciate that. And I'm sure our community members who will listen to you will also appreciate your very, very sound words of advice. For everyone out there, please visit our website, www.covidkenya.com. There is a lot of information there that will be updated daily as we all work together to go through these very critical times during COVID-19 pandemic. Manoj Bhai, thank you and good evening.
Thank you very much, Paras. Thank you, and take care and have a good weekend. Thank you.
Bye-bye.